We wear our vision on our sleeves, and we're extremely proud of it. And we see ourselves being the voice of the people. But the only reason that we can be the voice of the people is if we're out here connecting with, listening to, and having conversations with all of you about various subjects. So as I told you before, our original design was the Administration on Aging, the Administration on Developmental Disabilities, and the Office on Disabilities. But I'm sure, as we have with state government, we do with federal government, if there's one thing that we do best, it's reorganize. And move the deck chairs around and change the name of things, and we do it time and time again. Hopefully for efficiency purposes. But that's one thing that we're definitely good at. And ACL has experienced constant growth since we were formed in 2012. In 2013, we had 3 programs moved to us. The Senior Medicare Patrol, the Senior Health Insurance Program, and the Paralysis Resource Center. In 2014 was our biggest change. We had the Workforce Innovation and Opportunity Act, which became law, which moved 3 major disability programs from the Department of Education over to us. Independent living, assistive technology, and what used to be called the National Institute on Disability Rehabilitation Research. In 2015, we grew some more. We had the Traumatic Brain Injury Program moved to us, but specifically the one for the P&As, Protection and Advocacy Agency. And then in 2016, the rest of the program for TBI moved over. The state implementation grants. We have been growing and building the ship at the same time that we've been flying it. And because of that, and this is where I'm starting to get towards collaboration, focusing on collaboration, we haven't had time to gel as an agency. I'll be the first one to say that I look at my colleagues on the aging side of the house and their $1.2 billion worth of programming, and my good friend Edward Walker, and he knows we haven't had the time to have conversations to say, all right, tell me about the nutrition programs that you have on the aging side, and how does that match up with some of the work that we're attempting to do on the disability side? We haven't had that time to gel and have conversations. But we have tremendous opportunities in front of us. Last June, the Administration on Disabilities was created. And so under the umbrella of the Administration on Disabilities, we have the University Centers of Excellence, we have the state independent living entities, we have the CILs, the Centers for Independent Living, the Traumatic Brain Injury Program, 4 protection and advocacy programs, the Developmental Disability Council, the Paralysis Resource Center, and the Limb Loss Center. We have the opportunity to build, to create culture, and to do so from scratch. And we're trying to figure out, what does this mean? How do we do this? And how do we include individuals like yourselves in helping build that culture? Knowing that it's a partnership that has to occur at the federal level and at the state level. And moreover, I have to say, this isn't about me. Well, I'm the one up here on the podium and talking about this. I'm a political appointee. My term is coming to an end. And so the reason that we have Wilma Roberts, please raise your hand, from the Protection and Advocacy team, and Christy Samuels, who's from our communications team from ACL, who's here with me, is because this has to lie within them. They're going to be the catalyst for change at the federal level. They're going to be the ones who carry this forward long after I'm gone. And so if we're not inclusive of our federal staff and empower them to do this work and to be able to reach out to you in the community we're shooting ourselves in the foot. But we're here because, again, we need to build this relationship with you. We need to hear from you. We spent all day yesterday meeting and talking to self-advocates, talking to the AOD partners to get at the lay of the land of what's happening in the state of Arkansas, so we can think about it, we can ponder it for a while, we can steal ideas that we're hearing, and when we go to other states like we've had these conversations, we can start to trade ideas. So we've done this before. You know, over the past couple of years, we've been to Kansas, Wisconsin, Illinois, New Jersey, and a few other states. But that was before AOD formed. That's when the only disability programming that we had was on the DD side of the house. Now that we have independent living, now that we have limb loss, now that we have paralysis, to go along with DD, now when we go out, and we've been to Ohio, Massachusetts, Missouri, California, and where all of this started, Tennessee. We're having a new conversation. Tennessee asked us to come out approximately last year at this time. They were smart. They said, there's this new administration on disabilities that has independent living and DD together. We've done a couple of one-offs. We've done some work with our friends on the other side or between the two. But we want to do something more. We want to do something bigger. And so the Silk Executive Director and the DD Council Executive Director called us and said, would you come out and help us put together a mini strategic planning session? So we looked at each other and said, why not? So we went out and met with staff and spent a day and a half just talking about what's going on in Tennessee and what's our vision on people working together. And so in Tennessee, they came out with 2 specific goals that they were going to work on over the next 18 months to 2 years. 2. The first one is they wanted to focus on transition-aged youth. They wanted to figure out how can we do a better job coordinating our efforts to help build a better future for youth who are between the ages of 14 and 25, 14 and 26. And the second one was branding. They didn't want to go up and talk to legislators, educating legislators and policymakers and others about their narrowed and siloed programs. They wanted to go and say, we are part of a disability movement. We're joined at the hip, and we want to come up and have conversations about the work that we're going to do together, and we want you, educators, policymakers, to recognize who we are as a unique entity in the state.